Hospitals across the state are facing a shortage of nurses. According to a recent survey of 80 hospitals in the state, more than 6,000 nurses are needed to fill open positions.
So healthcare leaders in Washington say a number of factors are playing a role in that shortage, including the capacity for local nursing schools. Our Ian Smay spoke with local health experts about this staffing crisis.
The study surveyed 80 hospitals in the state that make up 85% of all hospital beds in Washington. Local healthcare leaders say the staffing crisis isn't new, and it also involves how many students local nursing schools can currently handle. Hospitals in Washington state are feeling the strain of a widespread staffing shortage.
We're not unlike any other healthcare organization throughout our entire nation. There's really a workforce and staffing crisis at all levels of talent. And as you know, it's been really sparse in healthcare for 10 years, and honestly, it's just getting worse.
According to Taylor, the pandemic only worsened the already present staffing shortage. A Washington State Hospital Association study found that 6,100 nurses are needed to fill the vacant full-time positions in the state. Providence says they are seeing 25% less applicants than 2019, and healthcare workers, including nurses, are leaving for reasons such as burnout, early retirement, and opportunities to become travel nurses. But the staffing issue isn't limited to just healthcare providers.
We have had pretty consistent enrollment for a number of years, but not any growth of enrollment.
Ann Mason is the Associate Dean of Academic Affairs at the WSU College of Nursing. She says the school is actually turning away qualified applicants because they just can't handle any more students.
In fact, every year we have a really significant number of very qualified applicants that we cannot admit because we don't have the faculty resources and the clinical placement resources to educate them.
Mason says that other nursing schools in the area have expressed similar concerns during regular meetings. She says WSU is exploring things such as simulated clinical opportunities and offering hiring incentives to attract nurses to transition to teaching. Right now, faculty salaries are lower than those being offered by hospitals. Taylor says Providence is working with colleges and even high schools to help out the situation. But even with their best efforts, Taylor says the staffing shortage could take a couple years or more to fix.
I wish I had the crystal ball to know, but honestly, I think we're really in it for the long haul. This is a long game. It's going to be a marathon until we get out of what we're calling the staffing crisis.
Currently, the WSU College of Nursing graduates about 266 nursing students a year. In the newsroom, Ian Smay, KREM 2 News.